Hello, in this video, I will try to answer frequently asked questions about lidocaine HCl cream. If you find the video helpful, don't forget to subscribe to support my channel. Let's get started. What is lidocaine HCl cream and what is it used for? Lidocaine HCl cream is a medication known as a local anesthetic. It temporarily numbs the nerve endings on the skin, making sensations like pain, burning, and itching less noticeable. It is commonly used for minor skin procedures, tattooing, hair removal, or treating painful skin conditions. How is it used? Lidocaine HCl cream is typically applied in a thin layer to the affected area. After application, you may need to wait a few minutes for the cream to take effect. The duration and amount of application depend on the condition of the skin and the procedure being performed, and it should be determined by a doctor. Covering the area with a bandage after application can enhance its effectiveness. How long should it be used? Lidocaine HCl cream is intended for short-term use. Prolonged or excessive use may cause adverse effects on the skin. Be sure to use it for the duration and amount recommended by your doctor. What to do in case of overdose? If too much cream is accidentally applied or the cream is ingested, seek medical attention immediately. Overdose situations can lead to serious health issues. Who can use it? Lidocaine HCl cream is generally safe, but it should be used with caution in certain situations. Pregnant women, breastfeeding mothers, young children, and individuals allergic to lidocaine or similar anesthetics should consult a doctor before using this cream. Precautions during use. Avoid contact with eyes, nose, mouth, or damaged skin areas. If the cream comes into contact with these areas, rinse thoroughly with water and seek medical help if necessary. Drug interactions. Lidocaine HCl cream can interact with other medications. It may be risky to use it alongside medications that affect heart rhythm or other local anesthetics. If you are taking other medications, be sure to inform your doctor. Side effects. As with any medication, lidocaine HCl cream can cause some side effects. The most common side effects include skin redness, irritation, a burning sensation, and swelling. Serious side effects are rare but may include hypersensitivity reactions, shortness of breath, and dizziness, which require immediate medical attention. This video was created to provide basic information about lidocaine HCl cream. I recommend that you consult your doctor before using this cream to ensure it is suitable for your condition. If you like the video, please hit the like button and subscribe to stay updated on new videos. See you in the next video.